Good morning, everyone. I'm Debbie Gould. I am the president for the League of Women Voters of Tennessee, and I'm delighted to have all of you here today virtually. Wish I could see you in person. And we're talking today about healthcare issues. And as you all know, for many, many years, the League of Women Voters of Tennessee has been very, very interested in seeing that healthcare issues in Tennessee get adequately addressed. And we have had advocacy issues on healthcare for many, many years and have taken strong positions about it in both the state legislature and also on a national level through LWVUS. And we are delighted today to have a very distinguished group of panelists who are going to give us new insights on this issue. And so with that said, I am going to turn it over to the very knowledgeable Judy Reutman of the Tennessee Healthcare Campaign, who will be introducing our panelists and steering us through some important questions as we go forward. So thank you, Judy, for taking this role.
Thank you for the introduction, Debbie, and welcome everyone to the panel in support of Medicaid expansion in Tennessee. My name is Judy Reutman. I'm the executive director of the Tennessee Healthcare Campaign. The Tennessee Healthcare Campaign is proud to co-sponsor this forum along with the League of Women Voters. The Tennessee Healthcare Campaign is a nonprofit, nonpartisan organization. For over 30 years, we've worked for equitable, affordable access to quality healthcare for all Tennesseans. We advocate for policies and programs like Medicaid expansion that improve the health and well-being of Tennesseans. We're also a nonprofit insurance agency, and as we speak, volunteers are answering our toll-free number and connecting callers to our licensed agents to find the best health insurance for them. I am honored to moderate today's panel with two of my healthcare heroes in Tennessee. Although they come from opposite sides of the aisle, today's presenters have both worked tirelessly to advance health policies that benefit Tennesseans. We plan to let them speak uninterrupted for the next hour. If you have questions, please write them in the chat, and we plan to reserve the last half hour of the program for audience questions. So Dr. Richard Briggs is a practicing cardiac and thoracic surgeon in Knoxville. He graduated from the University of Kentucky Medical School and then completed a surgical residency and cardiothoracic fellowship at Brooke Army Medical Center. He served in war zones, including Desert Storm, Afghanistan, and Iraq as a trauma surgeon and was awarded the Bronze Star. He retired from the Army with the rank of colonel. Richard Briggs is a Republican state senator representing District 7, which is West Knoxville, since 2015. He's currently chairman of the Senate State and Local Government Committee. He serves as a member of the Senate Rules Committee and Senate Transportation and Safety Committees. Prior to his election as state senator, Richard Briggs served on the Knox County Commission. Our second presenter, Gloria Johnson, is a Democratic state representative representing part of Knoxville in House District 13. She was first elected in 2013 and then won a rematch in 2018. She serves on the House Government Operations Committee. Gloria is a former chair of the Knox County Democratic Party. She advocates statewide for Medicaid expansion and for education policies. Gloria is a retired Knox County school teacher with 27 years of experience educating special needs children. She is herself the product of public school education. She graduated from Farragut High School and earned a degree in education from the University of Tennessee. So let's start out with my asking the panelists to give us an overview of how healthcare in Tennessee is currently funded.
If you like, I'll go ahead and start. This is Richard Briggs. And what it will really focus on, rather than all the private programs and the Medicare program, let's talk about the Medicaid program, because that's really what this program is about. It's about expanding Medicaid to cover all of our citizens. The way it's presently funded is that it's a 1/3 state contribution and a 2/3 federal contribution to the Medicaid program. Also in the Medicaid program, we have criteria about who can participate in the program, and it deals with children, the caretakers of children. It deals with our senior citizens, some of whom may be in a nursing home. It deals with pregnant women, and it deals with what we call the dual enrollees. Close to half of the beneficiaries of the Medicaid program are children, but then we still have a very large number of Tennesseans who do not fit into one of those categories. They're either below the poverty line, which means they still don't qualify, or they're what we call the working poor. These are people who are working, they earn an income, but they really don't quite reach the income level where they can go to the healthcare marketplace and purchase insurance. So roughly there's about 300,000 of our citizens that are in this uninsured category where they don't qualify for Medicaid. And this is the group that Gloria and I are going to be talking about today, and what we're trying to do to get them insurance.
Yes, one of the biggest issues for me is that coverage gap, and I know that Senator Briggs in his office is dealing with the same thing. So many times, we're not able to help folks. And thank you to groups like Tennessee Healthcare Campaign. I can sometimes send them to you all, and you can do your magic and maybe help someone get covered or navigate the process. And that is our concern, those 300,000 Tennesseans who don't have access to that care. One of the reasons that that this has been such a huge issue to me, obviously, I personally believe that healthcare is a right and everyone should have access. I believe that nobody should lose their home or business because they get sick. And, that was the situation with my sister. Her and her husband both lost their home and their business when my sister was very ill. Both of my nephews at the time were in Afghanistan in the military, and their parents lost their home and their business. So I'm dedicated to this fight. I know that we can do better in Tennessee, and I'm going to stay in it until we can get everybody covered.
So under the current funding, who's left behind? Does the current policy have a disproportionate impact on certain communities?
I think that there is a disproportion. I think that we find that more in our African American community, Hispanic community are not covered. I think that's very clear. We're even seeing that with the pandemic. We're seeing more problems there, and a lot of that is driven by the fact that they don't have the access to the regular care that they need and that would be so beneficial. So you absolutely see disparity in that care in our communities.
I'm going to even expand on that. Even if you go to our communities, if you go to our Appalachian counties, if you go to the West Tennessee counties, there's people. Tennessee is not a wealthy state. And we have a lot of low-income people who are working at $9, $10, $11 an hour. They don't have insurance. You can go into the counties that have very, very small minority populations, and they're not covered. So it's universal, it's urban, it's suburban, and it's rural. That those 300,000 Tennesseans that we are talking about, quite frankly, they're everywhere, and frequently they're our neighbors.
When the General Assembly voted for block grants last January, some thought that the savings under that plan would allow Tennessee to cover those in the insurance gap. Is that realistic?
I'll jump in here first this time. Let me explain just a little bit more how the funding works in Tennessee and what the block grants are all about. Tennessee requested a waiver, and this goes all the way back to 1995 when TennCare was established in Tennessee. And what that means is that rather than just taking the program as is under federal law, Tennessee makes application with CMS. This is the federal agency that funds Medicare and Medicaid, and said, this is what we want to do in our program. And those programs are approved by Medicaid. However, on the waivers, they said, yes, we'll give you a waiver, but there's a thing called the budget neutrality cap. And that said, this is the maximum amount of federal aid, federal contributions that we'll have to the Medicaid program. What we've seen over the years is that Tennessee has, and you know, whether you want to, whether you like the Medicaid program or not, Tennessee's managed theirs very well. And what this means is that Tennessee is well below what that budget neutrality cap is. And we're spending a lot less than what the federal government would allow us to spend. And what the block grant does, it takes that difference, or what they've requested is that it takes that difference between what the maximum amount that Tennessee is permitted to spend under the waiver and what we're actually spending. And we have told the federal government, we'll split that with you. You keep 50% of the savings that we have done through management, and then give the other 50% to us. And we would like to use those on programs that presently aren't covered, or we would like to expand coverage on existing programs. Now, to answer your question,
I'm going to interrupt you right here, and we do have a graphic that shows this. So
yes,
why don't we get that up?
And tell me when you have it up, because I can't tell. Here it comes. Okay, great. Okay. Thank you. If you look at the very top graphic, and this is what we had before. And you see Tennessee's line there at the bottom. There's a large gap between the federal funding, the federal funding level, and the difference for what TennCare is actually spending. That's up on the top. That's then. If you even go down here to the very bottom, on the very bottom, you'll see that that what Tennessee wanted to do is to be able to cover. This is the bottom one on the far right, where it says the block grant part is it says shared savings for Tennessee. It's in the bottom right hand. This is how much that Tennessee would have collected of half of the money that they would have saved below the Federal Budget Neutrality Act. Now, the federal government didn't propose that. And if you go back up to the top on the right, you'll see that there's this aggregated cap that adds up over the years. And this is the potential savings. It's not as much as if we'd stayed under the old system. And the reason is that Tennessee was being allocated their share of the funding based on national trends. And the federal government is going to recalculate that using on the state trends. Tennessee still believes that we can stay below the aggregated cap, and that there'll still be savings, but it may take a couple of years for those to build up to where we can draw those funds. But that's the basic, I know that's complicated, but that's the basic premise behind the block grant, is that through the savings that Tennessee can make in their Medicaid program, we'll be able to collect some of the funds that aren't being drawn down now and use them for certain programs. The point I was going to make right before you put the graph up is that no, it's not going to be enough money, even under the original proposal. It was not going to be enough money to cover all 300,000. Would there be a possibility of covering some people with that? Yes. Would there be a possibility of expanding certain programs? Yes, but there was not going to be enough money there to cover 300,000 people.
Okay. And so for me, you know, this is not an option, quite frankly. I mean, we have something we could do that's going to take in those other 300,000 people and provide the care that they need. I'm not really concerned with starting a new program. Quite frankly, we're finding out that we owe CMS over $700 million potentially. And so it's, that's concerning to me to say that we're going to handle it better. I'm not convinced of that, but I don't see a reason in changing what we're doing if we're not going to be adding people to the roles. And all that we know is potentially a couple of years from now, we might be able to add to programs, wherein if we expand Medicaid, we can add to programs. We can make sure that our hospitals are getting what they need, and we can take 300,000 more people on the rolls. So the block grant is a non-starter for me. I hope that it doesn't come to fruition, quite frankly, because if we're not opening up to more Tennesseans, if people are still dying in the state because they don't have access to the care that they need, we're not doing our job. And I know that Dr. Briggs wants to see those people covered as well. There's no question about that. There's a lot of folks on both sides of the aisle who would agree with us. And but sadly, just not enough. We've got to have the political will to cover those folks. And I just don't think that a block grant is the way to go if it's not going to cover a single one more single individual. It's unacceptable for me to make that change in our system when, quite frankly, I don't have any trust that the current supermajority is going to give Tennesseans the care they need, because they've refused them care for eight years.
I want to add one thing on that, and I agree with Gloria, but I want to elaborate on that a little bit further. And I agree 100%. There's not going to be enough money here to add any substantial number of people. I'm not sure they'll add anybody. Now, there will be some programs. So we're really, I think we're talking a little bit about apples and oranges. And we don't want, I think it's wrong for us to try to talk about the block grant program expanding Medicaid. There's just not going to be enough money there to do it. Now, what we can talk about is other mechanisms, such as the American Rescue Plan, because there were incentives put in there to expand Medicaid. And one of the questions that we talked about with this is that you could still put Medicaid expansion on top of this, because remember, we said this was the one-third state funding for the block grant program, or what it's replacing, and 2/3 by the federal government. Medicaid expansion is, we're talking about at a minimum 90% of the federal government. For every dollar the state puts in, the federal government puts in $9. And to me, that is almost too good to be true. And with the American Rescue Plan, that's even sweetened more, where Tennessee could get up an additional $900 million a year. So really, this is an apples and oranges comparison, because there's no way that we're going to be expanding Medicaid any substantial amount with the block grant program.
Gloria, I'd like to hear you weigh in on the American Rescue Plan and what that would mean for Tennessee. This was passed last spring.
Right. I thought, well, surely they're going to expand Medicaid now, because this is, how could you possibly turn down this much money? Ultimately it would make it zero cost for us for the next 10 years. With that extra money that was put in, would pay for the 10% that we have to pay. So it is ludicrous to me to refuse our Tennessee tax dollars coming back to us to care for those people in our state who are literally dying and have been dying as long as we have been refusing this care. I mean, I know people who have died because of a lack of access. And it is so tragic. It is the worst mistake that Tennessee has made in modern history, not expanding Medicaid. And it's popular. The one thing in working with Insure Tennessee and trying to get that passed that we found, you move the dial to more than 65% of both sides of the aisle support this plan. And the fact that our legislator is holding it back because of Americans for Prosperity and the Beacon Center, best I can tell, is horrible. And it is so frustrating that we have the ability to do this. Tennesseans are dying and we can't get it done. And with the American Rescue Plan dollars, it is going to be cost-free for years to come.
Let me put my Republican twist. And I agree with everything that Gloria says. I mean, I really do. I agree with every word. But what I would like to add to that is my Republican pro-business twist on this. This is more than just people's health. It's the health of a community. It's the health of counties. And I'm talking about their economic health. If you go to a lot of the small communities, the best paying jobs are the healthcare jobs in the community. We had a former commissioner of economic development said, I can't recruit business and industry into a community that doesn't have hospitals and doesn't have healthcare. We look at what the other expansion. So we're talking about the number of jobs. We're talking about well-paying jobs. We're talking about, and I thought just a perfect example in the introduction that Gloria gave, Representative Johnson gave, was about her relative that lost their business. How many people are entrepreneurs that would really like to go out and start their own business? They may have some really good ideas. They may be hiring people in the community. They're contributing to the tax base in the community, but they just don't want to take that chance because they know they don't have affordable health care to become an entrepreneur, to start their own business. So this is much larger than just the healthcare of individuals. It's the healthcare of a community and the healthcare of a state and business in a state.
And I always tell people too, they don't think about, you want to be the strongest nation in the world. Well, we're not going to be the strongest nation. We're not going to be the strongest state if our folks aren't strong, and you got to be healthy. You've got to be healthy enough to go back to work. We saw in so many states that expanded. Michigan did a great study on how many people got back to work once they had access to health care, could take care of their health issues and get back to work. So it absolutely, it's morally right. It's economically right.
I wanted to just ask about the impact on rural communities of our TennCare policy.
I'll jump in there first. I mean, it could be devastating. And I'm sure Representative Johnson's going to bring it up in just a few minutes. I mean, I bring it up every time I speak about it. Tennessee has had more rural hospitals closed than any state in the nation other than Texas. And Texas is several magnitudes of population greater than ours. And when that hospital closes, I've talked about it already, some of the best jobs in the community are gone, the best high-paying jobs. The impact of their incomes are gone. They're not able any longer to keep their citizens and then their young people who want to become nurses, or I don't even want to go to the doctor route because that takes so long. But particularly nurses, remember, you can get a 2-year nursing degree with the Tennessee Promise and not have to, it doesn't cost anything. But these people are having to leave their community to find work when the hospital's closed. And we've already talked about the inability then of a community and the Tennessee Department of Economic Development to recruit businesses and to recruit manufacturing if there's no health care. So this has a tremendous impact. And what happens, and we've seen these rural counties in the 2020 census, we've seen so many of them where the population is just getting smaller and smaller. And it really and truly is indirectly related to the lack of health care in those communities.
Yeah, that's absolutely right. Over the summer, I did some speaking at some of the rural counties. And typically afterwards, what I heard most, the thing that they wanted to talk about was either the waits at their hospital or the drive that they had to make to their hospital and the concern with losing people in their community because it takes so long to reach the hospital now. And what do you tell people. It's just tragic that that's where we are. And so many of these communities where I was speaking have lost their hospital and have a long way to go. And even when they go that long way, I remember one, I can't remember exactly the hospital. They had to drive a ways to a hospital in Cookville, I think. And then there was such a long wait there. They were trying to figure out what hospital they could get to that, more timely, and could they be seen? But it's hard to get, everybody's busy. This was during COVID too. So, you take the risk of trying to get to a different hospital, and do you get a longer wait? It leaves people just not sure what they should do. And it puts people at serious health risk. It's frightening. And then I know that in Jamestown, when the hospital closed, they had some shady practices as well. And so not only did those people lose those good paying jobs, but the hospital wasn't paying their benefits. They didn't keep their medical insurance up. So they found out they were jobless, and they also didn't have the health insurance because the company had not been keeping up their premiums. It's just a tragedy for our rural communities that are struggling already.
The US Congress has been discussing a federal fix to this problem. And what would the passage of the Build Back Better plan mean for Tennessee?
Well, in my understanding, what it would mean are those 300,000 folks who are going without access to care would be able to get that care through the federal government. And so for me, the way I've been talking to people is, if I was the governor, if I was in the supermajority in the state, I would want the people looking to our governor for expanding Medicaid and making that care happen for people. But instead, they're going to be thanking President Biden for that access to care that they have, and our members of Congress who hopefully will support that plan. But I mean, I've already been talking to people who are just waiting for that to happen and hoping that can happen. It's sad because there's been so many times when people thought it was going to happen, and it's really tragic. I hope that we can make it happen, because it will give access to these folks that are so desperately needing health care. But you also getting folks' hopes up in case it doesn't happen is a sad one for me. But I think we can make it happen. And I'd rather see Tennessee. There's a lot of benefits to Tennessee expanding on their own for Tennessee. And I wish we would do it that way. I'd like to do it the smarter way. But I am going to be incredibly thankful to Congress and to President Biden if he is able to get this passed for the citizens of Tennessee.
Dr. Briggs, do you want to comment on that one?
Speculate on it. I don't think it's going to pass. I mean, I'm just trying to be honest. I think, I read the paper like everyone else does. I don't think it's going to fly.
Okay, well, we're all holding our breath on that one.
Let's bet a dinner, Dr. Briggs.
I'll bet Coke. I probably
I'm gonna put a link in the chat in case anybody wants to email their US senator or representative and tell them to vote for it. So if the feds don't pass it, or even if they do, what about the Tennessee legislature? In the past, the Tennessee legislature has not moved on this. How can we encourage them to change their minds?
I'll comment on that first, because I've carried this bill every year. Going back to when Governor Haslam first proposed it in 2015, we actually had two bills that year. It failed it failed very quickly. I think after 2 or 3 days in the special session that Governor Haslam had called, But then I brought the bill up again. Normally, if a bill fails in the regular session, you can only bring it up. If the special session counts as a separate session than a regular session. So I brought it up. It got 4 votes for the bill in the special session and 7 against, because we had 11 people on the health committee. But by the time we got to April, where we brought the bill back up again, it passed the health committee 6-2 with 1 abstention. So that was a complete flip. It then went to the Commerce Committee. This is in 2015, where it did fail. At the time, they were saying that we wouldn't even get a second on the motion, so it wasn't even going to be voted on. But it turned out it was voting on, and it on this committee of 9 people, it received 3 votes for, and then 2 people abstained. And basically, a lot of times when they abstain, these were Republicans who I think would have liked to have voted for the book, but it was still, in some circles, was still viewed as very unpopular, so the bill failed. Last year, I had a bill again, but I wanted to keep a little quiet because there was a lot of talk that this American Rescue, Plan Act was. I mean, quite frankly, it's so good. It's hard to turn it down, and we've talked about that. It could bring in an additional $900 million, which, as Representative Johnson mentioned, would cover us for about 10 years with no cost to the taxpayer, in addition to 1.2 or 1.3 or 1.4 billion dollars. So we're talking about a lot of revenue coming into the state for healthcare. I was just hoping, by not trying to bring this up, that there might be some negotiations going on. I think to get this, I saw someone pop the question up there, what's it going to take to get it through the legislature? I think we're going to have to take one of our senior people in state government, such as the governor or someone like that, to take this up as something that he or she wants to do in the future. Take an approach to it, explain it to the public. We have seen polls, and the polls are, even on the Republican side, and the Vanderbilt has done these polls. I've done polls in Knox County. It's about 60 to 65% positive, even among Republican voters. About 20% of the people have no opinion, and maybe 15% of the people are absolutely against it. So I think if we had leadership saying that we want to do this and explained it to the public, that's what it would take. I can just say that even in the Senate, and I can't speak for the House, there's been changes over the last 7 or 8 years on members. And new members coming in, and some of these new members coming in would be in favor of Medicaid expansion. But I think it has to be done. It has to be presented in the proper political manner. It doesn't do any good to show data. It doesn't do any good to show statistics and all of this, because at this point, it's a political issue and not a data or a financial issue.
Right. Yeah, you're going to have to appeal to folks in another way, because they know what the facts are. They like to avoid them sometimes. Some people do. And the Senate, has always been closer than the House to making this happen. But the reality is we've got to elect people that care about this issue. And we talked about that the other day with Senator Briggs and with Judy, that get out and work for a candidate. If you live in a majority Republican district, there are Republicans out there who support Medicaid expansion. And so elect those folks and help elect people who support it. But also, build that relationship with your representative, with your senator, show up, be present, help on campaigns of folks that care about this issue as well. Because, we've been fighting this fight for so long. I think people have gotten tired or defeated. And you just have to keep up the energy, find new people that are ready to fight it and ready to show up and ready to help on elections. So that's really where it's at, is we have to continue to show up, because I do believe there's always hope that we can get this right. I don't know when it's going to be, but I'm not going to stop the fight because there are too many Tennesseans that desperately need it.
I have run out of questions for our panelists, but we do have a little more time. If Dr. Briggs, Representative Johnson, if you want to say anything else before we turn it over for questions.
I want to talk, just get back to the block grant, because I think for the Medicaid program that we have and what we're looking at in the future, I really think that this block grant program is going to go forward, and it's going to be here for 10 years. And I really look at these to be two completely separate issues. I think there are some advantage. I voted against the block grant program twice, but the final one that came before us, I did vote for it, and I want to explain why. I remember very well back in 2005 when Governor Bredesen had to disenroll well over 200,000 Tennesseans from the Medicaid program, and he really pretty much had to do it because we were getting to the point where we can't balance the budget. And Tennessee is not like the federal government. I know a lot is made of this, but it's really true. It doesn't matter whether they have the money or not. They can spend it, they can print it, they can do bonds, they can do whatever. We can't do that. We have to balance the budget in Tennessee, and that's exactly what Governor Bredesen wanted to do. But Governor Bredesen, in my opinion, and there's going to be people out there who may be more experts, but I was involved in this because I was on the board of the Tennessee Medical Association at the time. He said the way to control the rapidly rising expenses on this is to control drug prices, because people forget that for about a 10-year period, we literally had 98 or 99% of Tennesseans covered. We were in the vanguard on this. We were the nation's leader. But what happened, it wasn't hospital expenses that were going off the board. It wasn't doctors' expenses that were going off the board. It was the cost of drugs. And Governor Bredesen had several plans to control those price of drugs. Part of the block grant plan is to allow Tennessee to manage their own formulary for this. Under present Medicaid and Medicare, for that matter, Medicare regulations, you have a federal formulary, and a doctor, as long as he wrote for a drug on that formulary, it didn't matter if it was I won't mention the drugs' names, but it wouldn't have mattered if it was a drug that you would take for antacids for heartburn that cost 2 cents a tablet, or the one that cost $11 a tablet. The doctor would write that, but there was nothing that the state could do about it. There is a way, and believe me, your insurance company, if you have private insurance, private insurance is considered to be the gold standard on all of this, is that they're going to make you, they're not going to approve the $11 a pill until you fail at some of these less expensive drugs. I'll just tell you about my own experience. I was on Lipitor. Lipitor was costing about $130 a month. Zocor at the same time for a month's supply was about, my father was on it, was about $3 a month. And probably for 80 or 90% of the people, the Zocor was just as effective at $3 a month as was the Lipitor at $130 or $140, sometimes $150 a month, because it was still under a patent. This is what we talk about, allowing the state to manage the formulary. And I think there are substantial savings that can come from that. But I'll just stop right now. But I do believe that the block grant has things, and these were proposed by Governor Bredesen, who you recall was a Democratic governor. I thought it was a very good idea then. And if CMS would have allowed him to do that, we would have 98 or 99% of our Tennesseans covered today, because he knew how to fix the problem.
Representative Johnson, do you want to weigh in on drug formularies?
Well, I'm hoping at the federal level they're going to do something, and I just don't see movement on that with our state legislature. And again, it seems like a whole lot of workarounds when we have a super easy solution, and that's where the work should be happening, in my view. I just think that we need to continue to work for making sure everyone has access. And some of these ideas are good ideas, and I'd like to see that work being done as well. But when you could tomorrow, we could expand Medicaid tomorrow, and that's the frustrating part for me.
Let me add one more thing. The part that I was talking about managing the formulary. Now I know what you're talking about is drug price controls, and I've been working on that with diabetic medicines. But this is in the block grant that's that I think will be approved. Is where the state. This is the first time CMS has ever allowed anybody to do this. Is to manage the formulary, and I want to get back just a little bit about how to get this done. I know a lot of the people who are very passionate about this are of the Democratic Party, and I respect a lot of those. I respect a lot, the people, but it doesn't do a lot of good if you're going into a really strong Republican district and think that you're going to elect, a Democrat who will do it. I really think you're better off if trying to be really smart about how you're going to go about doing this. And if this is, somebody that's been in office for 20 years, it's going to be tough to defeat them in a really conservative district. So what you have to do is change their minds, or if it's a close race, but you sort of know who's going to win. Is you got to pick a winner, and if you if you get on the winning side, there's some benefits to that, and then it's time to call in the chits that you've garnered by being on the winning side. But make it very clear that if you're going to work for a candidate, is you really would like to see them address the healthcare issue, and I think that's how you can change minds, rather than trying to do, particularly if you're a one issue platform that you have, is you've sort of got to play the politics of it and look at it very carefully about how you want to approach it.
And to that, I would say, I understand certainly. And Dr. Briggs has stood firm on this topic. He doesn't waver. I've been to really conservative political events where he was there. And when it was very difficult, he stood up. It was, I don't know if you remember the one, Senator Briggs. It was one of the. Well, one in particular, I just remember it was at the Buddy's place. Yeah. And you stood firm, and you said they didn't like it, and you stood firm and spoke for Medicaid expansion. But too many of those Republicans get in there and they get afraid of who's going to come after them if they don't do what the extremists want, quite frankly. And it's hard for me to trust that somebody who's going to run. We had a lot of folks run on no vouchers, and then they got in there and they voted for vouchers. So, I don't think there's going to be a Democrat that's not going to vote for Medicaid expansion. So, but I understand. I certainly do think in some of these very conservative districts, it's good to find a Republican who says that they're for it. But man, you got to hold their feet to the fire, because when they get up there, a lot of them will do what they need to do. And I can't say that most people would stand up like Dr. Briggs does and dig in and say this is the right thing to do.
Thank you both for this back and forth. It's been fascinating, and I'm watching all these questions come in on the chat. So let's go ahead and try to get some answers for the audience. And I'm going to ask Marion Varner from the League of Women Voters to read off the questions for us. If you think of a question, go ahead and type it into the chat, and we'll give the panelists a chance to address it.
Okay, the first question is, well, it's a comment. Seems the focus on funding may be the wrong metric instead of focusing on public health level of Tennessee residents. And then there's a question that says, please explain how the Tennessee state legislature has thwarted voting on Medicaid expansion in Tennessee.
Well, as Dr. Briggs says, he brings the bill, and a lot of times it gets killed in committee, and you have to have a second on a bill for it to be heard. But I would say, and I don't know if he would disagree with me on this, but I would say the thing that's thwarting the bill are organizations like the NFIB, the Beacon Center, and Americans for Prosperity. Americans for Prosperity took total responsibility and accolades for stopping Medicaid expansion. They put out press releases. We stopped this thing. And so what I tell people when it's time to vote, go look at the financials of the people that you're voting for. Who are they working for? Who is filling their coffers, and who are they going to work for? Are they going to work for the people of Tennessee, or are they going to work for these special interests that are giving them funds? And a lot of times we see that these folks rarely get a lot of donations from regular people, but the donations come from some of these organizations and the special interest group. So we shouldn't have organizations that overwhelmingly are funded by outside funds stopping Tennesseans from having health care. But that's what we have, because we have too many legislators who are concerned about those monies to fund their campaigns.
One thing I completely agree with you about is these outside organizations. I can tell you when this came up in 2015, now this is when Governor Haslam, particularly in that special session, I always, we have some long meetings, and I'll count how many seats we have out there. There were 220 seats in the hearing room where that occurred. Literally one half of that, there was an aisle down the middle. This was in the old building before we moved to the new one. They had these red shirts on, and every time you stepped outside, because remember, only one committee met, and I was on that committee, so I know what the heat was. But every time you stepped out, there were going to be, and the room was packed, so they put television. They always have big television monitors for the people that can't get in the hearing rooms to be out there. You would step out, and you may have 50 people with these red shirts that said no Medicaid expansion would just surround you. There was a member of the House, a Republican member of the House, who now they weren't voting on anything, but he made a comment on television that, this may make sense, particularly for my constituents in rural Southeast Tennessee. The next day, with the money that they had coming from out-of-state sources, there was a television ad, and on the page 3 of the newspaper, it was a full-page ad. By the way, page 3 is the best place to put an ad about how Representative blankety blank had sided with Obama and was going to force all of this extra, even though it wasn't going to do it, but just basically printing untruths. And it's very hardcore opposition that you run into. The NFIB, and that's the small business organization, they did come out against it, but they admitted that their membership was split. And that's where I think education can make a difference, because I don't think small businesses are necessarily going to be against it. And for some of them, it would be really good, because if you had the Medicaid expansion, then they would have a healthier workforce for these small businesses. So I don't think that they're necessarily against it, but I know there's one organization that I won't mention that Representative Johnson knows what I'm talking about, and they play hardball.
Yeah, I remember at that time too. I don't think I was in the legislature at that time.
Yeah.
But I was down there, or maybe I was. They had a setup where they would get you to stop and get your picture made in front of the backdrop of their organization. And boy, every Republican stopped by there, or I don't know if everyone, but a whole lot of them. If you didn't stop by there, and get your picture made in front of their banner, you were in trouble. And that was all, going on during the healthcare talks and everything. So it was big pressure. And I remember those red shirts, because apparently they went in and saved their seats by putting the red shirts over the backs of the seats. And I remember seeing, the photos of that. But yeah, it's a hot mess. And well, you know, NFIB, but they're 90 about, I think they found about 90% of their funding comes from the Koch brothers as well. It's really not coming from small businesses, but you know, it just, organizations like that are hurting Tennesseans badly in a lot of different ways, education wise, healthcare wise. And I sure would like to see them go somewhere else.
Okay, the next question is, Senator Briggs says that Tennessee has done such a great job of managing TennCare that we saved the feds money. What have we cut to save that money? Did we fail to cover the expense of patients? Why have we not expanded who was covered?
I'll answer that question. That could have been done. You could expand some of it, but there wasn't enough money in that original waiver in that original waiver to do it. And as a matter of fact, on top of it, we have the hospitals came to us and they said, if you will tax us more, and you'll put that money into expanding, somewhat broader. And this was done. We called an assessment. Every year we vote on an assessment that's about it's a tax on receipts of 4.2% on the hospitals, and that money is used to expand. And I know people ask, well, why in the world does the hospital want to have an additional tax on itself? Remember, the hospital puts in $1, but they get $3 back. So it's a pretty good deal. And even when we were talking about the original Insure Tennessee program, the hospitals, remember I said that the state put in $1 and then they got $10 back because 9 came from the federal government. The hospital said, well, we won't even require the Tennessee taxpayers to put in that $1. We don't expect the state to do it. We'll do it. And the reason is it's even a better deal. For every dollar that the hospitals put in, they got $10 back. And man, I would do that all day long if I found some investment like that. But that's what they were doing. And they did agree to pay the 10% that was going to be the state's obligation. I can't remember. I don't remember the question. Did I answer it though or not?
Well, there's also a question, what have we cut to save the money from the regular program?
Well, what we did is we restricted. Remember, the one big group that I left out are adults, and it doesn't matter if they're at the poverty level or they're they're up to the 138% of the poverty level. If you make $400 a month and you're a single male or a single female and you don't have any children dependents, you can't get on Medicaid. If you make $800 a month, you can't get on Medicaid unless if you're an adult, a working adult, unless you have children or you're pregnant. And that's how we did it. We did not expand. See, some of the states, if you were below the poverty level, it didn't matter. The only adults that can get on Medicaid are our senior citizens, and some of them are going to be dual enrollees, and these are the ones that are in the like in nursing homes, they can get on it. But if you're a non-working adult who doesn't have dependent children, or you're not pregnant, it doesn't matter how poor you are, you cannot get on. You can't get on the Medicaid program. The one that,
or even working sometimes, but just at a low paying job.
Working, but still be very, very, very poor. But you can't get on unless you've got dependent children or you're pregnant.
Okay, so we have a couple comments here. Our governor says he is pro-business. Regardless of health benefits, Medicaid expansion just makes business sense. And the next one is, most common reason for bankruptcy are health expenses, and most under $50,000.
Agree.
Yes, there's no question. And you say you're business friendly, but you don't seem to understand. I think he's more of an ideologue than he is who actually cares about the economics of Tennessee, but because he lets his ideas get in front of what's good for Tennesseans. both health wise and education wise. I see it every day in the policy, and it's very, very frustrating because, as you know, Senator Briggs pointed out, economically, it's the way to go. Keeping Tennesseans healthy is good economic business. So it's when your ideology gets in the way of the health of Tennesseans.
Let me say this about Governor Lee, because I believe that he really and sincerely, I'm always a little concerned when people talk too much about their Christianity or their religion, but I really do believe that he is a believer. And I wasn't one of the people that believed that initially, but I do now. I see the concern that he has for our prisoners and trying to reintegrate them into society. It's a sincere belief that he has. He does have to face political reality, which, at least on some of these very loud groups that are against it, I don't think he's ready to take that initiative. But I am not completely ruling out the possibility after the 2022 election that we may see something done. And there's no question Tennessee is doing better and better with business, particularly this Ford plant down in West Tennessee. It's going to be almost a $6 billion investment. 6,000 workers. Is that what we could start to see with these higher salaries coming in at businesses like that? You may hear more and more of the small businesses start to complain because they're going to draw off the more motivated, hardworking, healthy people, and they're going to have health insurance. And so how will small businesses that don't provide for the working poor, that don't provide health insurance, what are they going to do? I read just the other day, and this almost completely astounded me, that for the family plan, it now could cost businesses up to $2,200 a month. I mean, I'm not going to do the public math on it, but I can tell you that's an awful lot of money. An awful lot of money. I meant, $2,200 a month for the insurance plans, and small businesses aren't going to be able to afford that, and they're going to lose their workers to these other good jobs that are coming in the state. So we may start to see pressure from them to, for the governor to do something. But I really believe he understands the problem and he cares, but it's just the political realities that. That he just isn't willing to do it. But once he becomes reelected, he becomes a lame duck. I'm sort of keeping my fingers crossed we may see something.
I guess it's impossible for me to accept the fact that political expediency is when you start saving lives. The idea that he's allowing people to die so that he can get reelected is 100%. No, I know you didn't say that, Senator Briggs, but that's the political calculus. That's the political calculus that's going on here, in my view. And, you can't care deeply about the people when you're willing to let them die for 4 years. But because that's happening, that is the reality. It's not that situation where I'm saying so-and-so is killing people. It's not like that at all. But not doing the thing that would be so helpful to every Tennessee family, those that are affected, but also those around them. And we have to do what's right when it's right and not when it's politically expedient. That's just, I feel deeply about.
There are people that don't go in to get their health care. But let me give you an example. Right here in Knox County, people can get health care. First of all, under the EMTALA laws, no emergency room can turn you away. Now, emergency room's not where you want to go. But the Knoxville Academy of Medicine, we have the Knoxville Project Access. We have Dr. Kim's Health Cares of America. We have the Interfaith Clinic. So people are getting care now. Is it as good a care if they could, sort of go in as they want to? No, it's not. But we do have ways to take care of people. Women aren't being turned away having babies in the parking lot. And when people are coming to the hospitals and our local medical organization. We have the Project Access, here in town, where I forget how many docs we got in town, maybe 12 or 1,300. About 95% of them, of all specialties, participate. So, we do have an infrastructure. We've got Cherokee Health, and we have others where people can get care. It's not as good as if we expanded Medicaid, and even them providing care. Remember, we've had 2 medical centers close in Knoxville in the last 10 years. Baptist closed in 2008, and St. Mary's closed in 2018. And a lot of that was related to the high percentage of the uninsured that they had. So, so there are consequences, economic consequences and health consequences, but people aren't, simply dying in the street. And I do want, I'm taking up for my profession. I do want to take that. No, I want to take up for my medical profession, because we've risen to the challenge. And Dr. Kim, and I mean, I think Interfaith Clinic is a wonderful organization.
Yeah.
Yes. Because now they're primary care, but they can go to Project Access that's run by the Knoxville Academy of Medicine and get specialty care through them. The hospitals provide that care free too.
But people were concerned a lot of times. One friend of mine in Nashville that passed away was because going to the hospital because of his cardiac issues, it was, he tried to avoid those bills and avoid losing everything because of hospital bills. People put that off so many times because they are afraid of losing what little they have. And these are not, these are people who are working, but they just know that emergency room bill could be exorbitant and put them in a situation where it could hurt their family. And so the reality is for multiple, that's only one of them, for a lot of reasons, people aren't getting the care. And those who don't know where to go, they don't know about the Interfaith Clinic, hopefully we tell as many people as we can, and Dr. Kim, but they're, that's not to say that there are people out there who are not getting care. And yes, people are passing away. That's just, it's a fact.
Well, going on to the next question, how can healthcare workers be confident they will not lose their healthcare coverage if rural hospitals close? How are hospital administrators held accountable to their workers for providing health insurance coverage?
Well, if the hospitals, if they lose their jobs when the hospitals close, they won't have coverage. And now, as far as the hospital administrators, I think most of the hospitals provide health care. And I think that Representative Johnson did talk about one of the hospitals that had fallen behind on paying. I think they were behind on everything. They weren't even paying their, or maybe it was another one that wasn't even paying the normal contributions to Medicare and Social Security like they were supposed to. But I believe that most of the hospitals have healthcare benefits, for their full-time employees. And I mean, I worked for the hospital system here in town. The last couple of years of my practice, I was private up until 2013, and I thought it was a pretty good deal. I had good Blue Cross Blue Shield insurance, and paid very little. I think my family plan was $150 a month or something. It wasn't very much in the hospital.
Yeah, I've seen that as well. It was just this one particular hospital. I think they might have had a couple in Tennessee, but it was this one particular organization that was letting that happen.
Okay, so then in the chat box, we have a message from Judy Reutman about to send a message to Congress, a federal solution to affordable care, health coverage in Tennessee, tnhealthcarecampaign.org. And the next question is, why won't it pass? That's referring to the federal legislation expanding Medicaid, sorry.
I'll comment on that, because I think it's not entirely a Republican issue, because Senator Manchin, and there's been several Democratic senators. The concern is just the cost, and at some point, and I think this has to do with a lot of the of the federal budget. I mentioned in Tennessee, we have to balance the budget. The federal government doesn't, but sometimes those bills have to be paid. And just how much can you run up your credit card when you start to say then that we just can't afford it anymore. Now, I know that healthcare is important, but so was infrastructure, and so was the CARES Act, and so was PPP. And, I could go on and on and on. So is Medicare, so is Social Security. Those are all important, but they're expensive. And the question is, how much of a tax increase, how much taxes will the public, will the public say, I'm willing to pay for this? And I don't like to throw politics into policy, but I think the public said in Virginia and in New Jersey that maybe they would like to have all of this, but they realize is that someday the bill's going to become due. And I think that's just it. It's just the federal deficit's getting bigger and bigger. I think that's going to be the main issue, because it's not just Republicans.
Well, and I think they've run the numbers, and I think that was one of the things that Senator Manchin had talked about, was it needs to be paid for, and it is now. My understanding is they've run the numbers on Build Back Better, and that it is paid for. So again, I say it's those special interests that are causing this problem, and the big donors that are causing the problem with it.
The next question is, what do we know about the 20 to 25% who have no opinion in the polls about Medicaid expansion? Would moving them to positive make a difference to legislators in 2022?
I don't think we know a whole lot about them. It's just the part of the public that may not be as well informed as other people are, so they don't have an opinion. If those people are if they would be, politically active, or literally locally, it would be on a door-to-door campaign. You would explain to them, it would. I think it could make a difference. But I think also those of us who really believe in this and believe that it's good for the state, it's good for the economy, it's good for the health of the people of our state, that we have to get out there and say that it is, and then explain that your taxes aren't going to go up with this. If anything, your taxes may go down. You're just getting back your tax money that you've already sent to Washington. That the other states, what is there now? I know there were two more after the American Rescue Plan came out. There were two more states that decided, Oklahoma and Missouri, that decided they're going to expand. If you look at the southern conservative states, Louisiana's expanded, Arkansas has expanded, Montana, very conservative state, has expanded. So I think it's just a matter of explaining that this is just it's good business for Tennessee to do this, and this doesn't really cost us anything, but it'll be bringing a lot of our tax dollars back into the state.
And I think, that Senator Briggs hits it, and he does this in his district, and I do this in my district, is educating people. Most of the time, people don't really understand how it works. And when they do, they get it. And unfortunately, a lot of our colleagues don't take the time to educate the people in their district about those issues. They don't take the time to let people really understand how this could benefit them. And that's a very frustrating thing to me, because I feel as a legislator, it's my job to educate my constituents on the issues, regardless of where they might fall for it or against it. I think that we need to be educating people on these issues. More people get involved if they understand what's happening. And we need more people involved, and we need people who listen to the facts, how it affects them, and makes their decisions based on being informed.
Okay, the next question is it true the lieutenant governor controls whether bills can be brought to the floor of the Senate? If the lieutenant governor is determined to thwart Medicaid expansion, How can such a bill ever be debated publicly and voted on by the legislature?
I'll comment because that's a Senate question. The governor really doesn't do that. I mean, what the process is that when a bill is like, say, I have a bill and I've had one every year, dealing with Medicaid expansion, and the Senate clerk will then assign that to a committee, and sometimes it'll go to 2 or 3 committees, because it would go to the Health Committee, it would go to the Commerce Committee, and it would go to the Finance Committee. And the governor really doesn't interfere with what happens in the committees. I mean, he might if it's something that's not necessarily on this, but this thing has passed. Other than that very first special session in 2015, it's passed through the Health Committee easy. And then where we've run into a roadblock has been in the Commerce Committee. And it has to do with what the members were on the Commerce Committee, because sometimes you'll have a very good bill, and just the way that a particular committee that it has to pass through, it may not even represent the majority opinion of the legislature of either the Senate or the House, but you just can't get it through that committee. And we went through a 4-year period that there was not one in the Commerce Committee, that there was not a single consumer favorable bill dealing with healthcare that got through, not a single bill over 4 years. And I'll say this about Lieutenant Governor McNally, is that he reconstituted that committee this past year. And now there's some really good bills are getting through. And he changed who some of the members were on there, because he thought there was it did not represent necessarily what the composition was of the Senate as a whole. And we did get some bills through. We got some very good bills through, that dealt with health care. And we've also had a change. We've had 2 or 3, I'm not going to mention names, but we have 3 new members of the Senate who replaced people who retired or didn't come back for various reasons, who those former members would have all been very vocal opponents of Medicaid expansion. And these 3 people are very vocal for Medicaid expansion. So are 3 people enough to change minds? No, but we're getting there. It's getting better, I think. But the holdup has still been the Commerce Committee.
Okay, and Judy Reutman has posted to send a message to our Tennessee lawmakers. We all benefit when people are insured. You can go to tnhealthcarecampaign.org.
Mm-hmm.
Here's a comment. My hearty thanks and commendations to Senator Briggs and Representative Johnson for their smart, dynamic, and persistent advocacy of Medicaid expansion. Dr. Briggs is exactly right about the data-resistant opposition. We're seeing that phenomenon with the anti-vaxxers. It's tragic manifestation of the Dives effect, but keep the faith and never lose hope. So our next question is, what steps is the state taking to prevent further hospital closings?
One of the things we did in the budget, because Governor Lee has been concerned, most of the hospital, people talk about rural hospital closings. Again, we've had 2 closures right here in Knox County, but Governor Lee has really focused a lot of his term as governor on the rural counties. And there has been, and we could say the same thing about fighting the opioid epidemic. He has put in his budget some monies to help the rural hospitals, and I forget what the program was called. And I really want to thank him for doing it. But the truth is, it's not enough. It's not enough to do it. The problem is that the rural hospitals don't have a good payer mix. They have a disproportionate number of people with no insurance, a disproportionate number of people that are on Medicaid, and a disproportionate number of people that are on Medicare. And the Medicare program, it's hard for the hospital to make money on those. It's about a break-even program, or a little bit better. but they lose money on Medicaid. But at least with Medicaid, you don't lose as much. And of course, we call them self-pays, which really means no pays. These are the people with no insurance, and that's the real situation in the rural hospitals, is that they just don't have a good payer mix. There's not enough people with good full insurance to to cover the people that either don't have insurance or they're not good payers. Not payers. I mean, like Medicaid's not a good payer, but 20 cents on the dollar is better than nothing on the dollar.
Yeah, that's right. There have been those moves to do a little bit of that, but it is the proverbial drop in a bucket because the need is so great. And, it sounds like a lot of money sometimes when you say to the average person, well, we put 3 million into this for opioids here. Sounds like a whole lot of money, but the reality is, well, that's 8 beds, and so that's not going to move that dial. And it's frustrating. It's an attempt, but it's not even a drop in that bucket. And it's so, to think in those terms of dollars is difficult for a lot of Tennessee families, but the costs are great. And unless you're really going to accept that 1.4 billion a year and those extra, 900 million, we're not going to be able to get at it the way that we need to get at it. But there have been attempts. It's just it's Band-Aids.
Okay, so the next question, I think it's been discussed some. I don't know if you want to discuss more. It says, if the federal government will pay 90% of the funding and the public in general supports Medicaid expansion in Tennessee, how can the Tennessee state legislature vote against Medicaid expansion?
I'm going to make 2 real comments because Gloria has really explained this well. And I agree with what she said. First of all, with this new program with the American Rescue Plan, it's closer to 95% or even more is going to be paid by the federal government. And the second thing is, it's not just the fact that, and I want to say the polls that I have done, just in my district, because the main thing I'm always concerned about is the Republican primary and what the Republicans are thinking. It's 60 to 65% of the Republicans in my district, and these are Republicans that vote, would be in favor of Medicaid expansion, and about 20% are neutral and 15% against. But I think it's what Gloria talked about a little bit earlier about these bigger organizations who are down there, and they're very, very aggressive, taking ads out, taking TV ads out. And I mean, they react quick and they've got the money. And that's what I think a lot of it is. It's those organizations that Representative Johnson was talking about.
Okay, we have a comment. A healthy workforce is good for the economy and good for business. And then we have a question. Tennessee Healthcare Campaign once showed a chart of who is covered by TennCare. 2/3 of funding goes to nursing home residents and people with intellectual developmental disabilities. I suspect a lot of them may be on multiple medications. Pulling some of their drugs and replacing them with generics that have already been proven to be either ineffective or had bad side effects. So how quickly will TennCare okay the drugs that they have used for years and are working for them without bad side effects?
First of all, let me make a comment, because the assumption is that they've tried the other drugs and there's bad side effects. You don't know that. Let me just tell you a little bit about how these drug companies work. If you remember, at least for the Affordable Care Act, and President Obama knew that he could never get the Affordable Care Act if he didn't have the drug companies, big pharma, and the insurance companies on board. And so that's where they came up with this federal formulary. They do have the drugs on there, but they also permitted big pharma to put a lot of the very expensive drugs on there. And then what big pharma does, they go out, they have we call them the drug reps, the pharmaceutical representatives, goes around to the primary care doctors. These are the same people that are seeing Medicaid, and they're marketing the most expensive drugs on the federal formulary. And I think I gave the example before about Lipitor, and I won't go through all that again, Lipitor and Lipitor and Zocor. There was another drug. Governor Haslam asked me about this one night at the governor's mansion when I was over there. He said, did you know, and it was an antibiotic that used to be 11 cents a capsule, and now it was $1.40 a capsule. And that one little bit was going to add $50 million. That price had gone up. There were two or three generic makers, and then they it went to one making the drug. This wasn't a new miracle drug. This was an old drug, but now there was only one supplier, and so they could set the price. And he was asking me about all of this. Even though he's not, I mean, he understood it also. And I think that what they're really saying with managing the drug, it does it just like your own insurance company. Your own insurance company doesn't allow you to go to the most expensive drug first. If your doctor wants to do a CT scan or an MRI, he's got to get the permission or the clearance from the insurance company. And we're talking about managing the medications and managing tests and managing other things similar to what your nice Blue Cross Blue Shield insurance does, because before you do just about anything these days, you have to get approval. And that's what we're talking about. And we're not talking about putting people on drugs that they've already had an allergy with. It's just that if you have a choice, and again, the lesser drug will work and not work fine without problems in 90% of the people.
Okay, we have several comments here. I'm really concerned about the future of our children, as 30% of children are on TennCare, I believe, and 50% of pregnant women. Hospitals have closed OB units across the state. As you leave Knoxville going north, no OB units except Hamblin County. Children's hospitals also struggling. And the next comment, I applaud the Knoxville delegation for leading the way for expansion. And another comment, the saying is, I hate socialized medicine, but don't touch my Medicaid. And then we have a question. What is the name of the organization that supports the red shirts?
Oh, I put that in the chat. It's Americans for Prosperity is one, and the Beacon Center is the other. I think the red shirts were American for Prosperity.
Okay, here's another question. So why does Tennessee brag about managing TennCare so well when they did it by cutting people out of the program?
That was a question you'd have to ask Governor Bredesen. But back then the problem was, and I'm not going to be critical of what he had to do it. It's just TennCare had grown to the point where it was consuming 40% of the entire Tennessee budget. And I'm going to go back to something I've mentioned a couple of times. Tennessee has to balance their budget. If we took that and put more money into Medicare, how many school teachers do you want to fire? How much do you want to cut the funding of schools? There's several big items in the Tennessee budget. You have TennCare, Medicaid, but 2/3 of that's paid by the federal government. Almost all of education is paid for by Tennessee taxes, by Tennesseans. And even though the Medicaid budget is a little bit bigger, they're almost equal. The third biggest part of the Tennessee budget is TDOT. And there, by law, all of the gas tax money has to go back into roads and bridges. So you can't touch that. And then after that, you really don't have any place in the budget where you can, you don't have any place in the budget where you can take money out of it. And so really what we have to decide in Tennessee, are we going to cut education to pay for Medicaid? Or what are we going to do? We don't have a state income tax. That was defeated a number of years ago when it was proposed by Governor Sundquist. And I will point out, I will throw a little partisan politics into this. You had a Republican governor that proposed an income tax that was defeated by the Democratic House and Senate. And it was also the Democratic governor that cut all the people off of TennCare, but just as a background. But right now, we cannot have we can't have a state income tax. That's off the table. And so the only tax that we could increase is the sales tax. And we already have one of the highest sales tax in the country. So when we're talking about, increasing something or spending more for Medicaid, where do you get the money? Again, we have to balance the budget.
Okay, we have a couple comments here. For penetrating exhaustively documented insights into flood of secretive funding for antisocial legislation, I recommend Jane Meyer's Dark Money. Another comment, another reason TennCare is so, quote, efficient is that most of TennCare enrollees are in managed care plans. So the managed care organizations bear a lot of the administrative expenses that other states have to account for. And now we have a question. Does Governor Lee believe in science, though? How can you account for his failure to protect the health of children and families from COVID?
That's a good question.
Well, I'm going to give you an answer that got me in a lot. I'll let you comment, Representative Johnson, and I'll make a comment that got me into a lot of trouble, but go ahead.
Well, you know, I question his belief in science, quite frankly. It's very clear. He says he's listening to doctors. We don't know which ones he's listening to because the thousands of doctors across Tennessee that are speaking up and begging him to do something as far as mitigation or even encourage the vaccine, which he will not do. It's incredibly frustrating. And again, to me, it's politics getting involved, you know, making the decisions for him. His fear of primaries and that sort of things by someone even more extreme, if that's possible. But it's, again, it's putting Tennesseans' health at risk because he's doing political calculus instead of listening to the doctors and the immunologists and all of these folks. It's incredibly, incredibly frustrating. And again, he's putting his political calculus ahead of Tennesseans.
I'm going to give a different take on that because I think he does understand, and I think he does understand completely, and he has encouraged people to get vaccinated, and even our local school board. This is an issue that I run into, and you all haven't followed all the details of what I've said about it, but I've been on TV many, many times. Get vaccinated, masks work, social distancing works, good air circulation works, monoclonal antibodies work if you're sick. You know, I mean, all the stuff that, you know, that I would consider to be good medical care. But when you're in a position, and I'm gonna use the school board as an example, and I'm very supportive of what our local school board has done. You have two responsibilities, and it doesn't matter if you're a state representative, a senator, the governor, or the school board, is that the school board, for instance, really has two primary responsibilities. One is to educate our children in the best manner possible. And the second responsibility is to do that in a healthy environment. And it can't be 100% one way or the other. We could say we can keep our children and our teachers healthiest if we just shut the schools down. And then we said, well, we got to have some learning. So we tried the online learning. You know, we really didn't know anything about this. This was completely uncharted waters when the COVID epidemic began. So we tried the online, and we know that our kids did not do as well at home as they do in a classroom with a teacher, a real live physical teacher present. And I think that says an awful lot about our teachers, about how important they are and how valuable they are and how underpaid they are too, maybe. But the school board tries to take this mixture of getting the kids back in the classroom, which is really important, but doing it in a safe manner. And you can do that. This has been shown. The CDC they've done huge studies with thousands of schools as, you know, as controls, where one school did all the things, preventative measures, right, but they were in the class and other schools didn't. And the mitigation measures work. But that's a little bit about what the governor has to deal with. And I really believe, he and I've had this conversation, he understands the science completely. He's a very bright guy. You could shut down all the businesses again. I mean, we could have kept the businesses, all businesses shut for 2 years, but people have to have jobs. You know, these are family businesses. that are really struggling. And do we always get it right? I mean, what's the right balance? We don't know. We haven't ever had anything like this, and we certainly haven't had it for 100 years. Now, the answer to me, is it more masks or less masks or all this other stuff? But get vaccinated. And if anybody out there hasn't been vaccinated, get vaccinated. The thing's not going to go away until we do. And this most recent crisis that we had in September was a crisis of the unvaccinated. It wasn't a crisis of the entire population.
Okay, I'm gonna have to call time out. I think we could probably do a whole other forum on COVID, but we are actually out of time. And I want to thank our panelists for being on the hot seat for 90 minutes here. Thank you very much for all your insight. And I want to thank everyone who joined us. And a huge thank you for all the work behind the scenes from the League of Women Voters of Oak Ridge. Carolyn DuBois, Abby Moore, Marion Varner, thanks for bringing this event to fruition, and thanks for your continued advocacy. I want to add my voice to those of our panelists urging you to get involved. Contact your elected representatives, question candidates on their stands, be a healthcare voter. We welcome your involvement in the League of Women Voters and the Tennessee Healthcare Campaign. Thank you all for coming today.